Hello everyone, welcome back to the Doodle Nurse. Today we will be talking about the origins of psychiatric illness and the foundations of psychiatric assessment. Understanding mental illness requires more than simply memorizing diagnosis and medications. As future psychiatric providers, we must understand the many factors that influence mental health and how those factors interact throughout a person's life. Mental illness is rarely caused by a single event or a single biological abnormality. Instead, it develops through a complex combination of genetic, biological, psychological, social, and environmental influences. Every patient's story is unique, which is why comprehensive assessment is very essential. Throughout this content, we will explore major theories regarding the origins of psychiatric illness, discuss factors that increase risk for mental health disorders, review assessment tools used in clinical practice, and examine important ethical and legal responsibilities of psychiatric providers. By the end of this content, you should understand how psychiatric disorders develop and how a comprehensive psychiatric assessment helps guide with diagnosis, treatment planning, and most of all, patient centered care. Please remember that this content is intended for educational purposes only, and it's not a substitute for professional medical psychiatric advice, diagnosis, or treatment. So let's begin. One of the oldest debates in psychiatry is whether mental illness is primarily caused by nature or nurture. Nature refers to biological influences such as genetics, inherited traits, brain structure, and neurochemistry. Supporters of the nature perspective believe that mental illness develops largely because of genetic predispositions and biological vulnerabilities. Nurture refers to environmental influences such as childhood experiences, trauma, relationships, cultural influences, education, and socioeconomic factors. This perspective suggests that life experiences shape psychological development and mental health outcomes. Modern psychiatric research shows that neither perspective alone fully explains psychiatric illness. Instead, most mental health conditions arise from the interaction between biological predispositions and environmental experiences. For example, two people may inherit a genetic vulnerability for depression. One individual may never develop symptoms because of strong social support and healthy coping mechanisms, while another individual exposed to chronic stress and trauma may experience significant depressive symptoms. Therefore, psychiatric illness is best understood as the result of both nature and nurture working together. Genetics play a significant role in many psychiatric disorders. Research demonstrates that certain genetic variations may increase an individual's susceptibility to conditions such as schizophrenia, bipolar disorder, major depressive disorder, autism spectrum disorder, and anxiety disorder. Family studies consistently show higher rates of psychiatric illness among biological relatives. Twin studies have also demonstrated strong genetic influences, particularly for disorders such as schizophrenia and bipolar disorder. However, genetics do not determine destiny. Having a family history of mental illness does not guarantee that an individual will develop the condition. Instead, genetic factors create vulnerability, may be activated or influenced by environmental stressors and life experiences. A common phrase used in psychiatry is that genes load the gun, but the environment pulls the trigger. This emphasizes the importance of understanding both inherited risk factors and environmental influences when assessing patients. Biological factors focus on how the brain and the body contribute to mental health. Neurotransmitters are chemical messengers that allow neurons to communicate with one another. These neurotransmitters influence mood, behavior, cognition, motivation, and emotional regulation. Serotonin plays an important role in mood stability, sleep, appetite, and emotion regulation. Norepinephrine, it helps regulate alertness, attention, energy levels, and the body's response to stress. Dopamine, on the other hand, is associated with reward, motivation, pleasure, learning, and movement. When neurotransmitter systems become dysregulated, psychiatric symptoms may develop. Low serotonin activity has been associated with depression and anxiety. Altered dopamine activity has been linked to psychosis, schizophrenia, and addiction. This regulation of norepinephrine can contribute to anxiety disorders and mood disorders. Biological factors also include genetics, hormones, inflammation, medical conditions, and brain structure abnormalities. Understanding these biological processes helps us future clinicians develop effective treatment plans. Psychological factors refer to the mental and emotional processes that influence behavior in mental health. Early childhood experiences significantly shape psychological development. Positive experiences promote healthy emotional regulation and resilience, while adverse childhood experiences can increase vulnerability to psychiatric disorders. Trauma is one of the most significant psychological risk factors. Experiences such as physical abuse, emotional abuse, sexual abuse, neglect, domestic violence, or loss can have long lasting effects on mental health. Personality traits also influence psychiatric vulnerability. Individuals with high levels of perfectionism, neuroticism, or emotional sensitivity may be greater risk for anxiety and mood disorders. Coping mechanisms are equally important. Healthy coping strategies such as problem solving, social support, and mindfulness can promote resilience. On the other hand, maladaptive coping mechanisms such as substance use or avoidance may worsen the symptoms over time. Psychological factors will help explain what people respond differently to similar life events. Environmental factors include the external conditions that affect an individual's mental health. Chronic stress is one of the most common environmental contributors to psychiatric illness. Ongoing exposure to stress can affect neurotransmitter systems, increase the cortisol levels, and contribute to emotional exhaustion. Social support is a very powerful protective factor. Strong relationships with family, friends, and most of all, community members can improve coping abilities and reduce psychiatric symptoms. Housing stability, financial security, employment, education, and healthcare access also influence mental health outcomes. Individuals facing poverty, homelessness, discrimination, violence, or social isolation often experience higher rates of this psychiatric illness. As future psychiatric providers, it is very important to recognize that mental health is not solely an individual issue. Social and environmental conditions often play major roles in a patient's well being. A comprehensive psychiatric assessment is a detailed evaluation of a person's mental, emotional, behavioral, and social functioning. The assessment serves multiple purposes. It helps identify symptoms, establish diagnoses, evaluate risk factors, determine strengths and protective factors, and also develop treatment plans. A thorough assessment examines the whole person rather than focusing solely on symptoms. This includes biological, psychological, social, cultural, spiritual, and environmental influences. The comprehensive psychiatric assessment forms the foundation for safe, effective, and evidence based psychiatric care. The clinical interview is often considered the cornerstone of psychiatric assessment. During this interview, clinicians gather information about the patient's presenting concerns, symptom history, medical history, psychiatric history, family history, social history, and substance use history. The interview also provides an opportunity to build rapport and establish trust. Effective interviewing requires active listening, empathy, open ended questioning, cultural sensitivity, and non judgmental communication. The goal here is not simply to collect information, but to understand the patient's lived experience and develop a therapeutic relationship that supports recovery. Now, let's talk about diagnosis and classification, which provides the common language used in mental health care. Mental health professionals use the diagnostic system to identify patterns of symptoms, communicate effectively with other providers, guide treatment, planning, and support research. Classification helps create consistency in how mental health conditions are recognized and understood across different healthcare settings. The two most commonly used diagnostic tools are the DSM-5-TR and the ICD-11. The DSM-5-TR, or Diagnostic and Statistical Manual of Mental Disorders, is published by the American Psychiatric Association and is widely used by mental health professionals, particularly in the United States. It provides detailed diagnostic criteria for mental disorders and helps clinicians make accurate and consistent diagnosis. The ICD-11, or the International Classification of Diseases, is published by the World Health Organization. It is used globally across the healthcare systems and includes both physical and mental health conditions. The ICD-11 supports international communication, research, healthcare reporting, and treatment planning. Although these symptoms have different variations, they share important goals. Both list mental disorders, describe symptoms, provide diagnostic criteria, and help ensure reliable and standardized assessments. Mental health diagnoses cover many categories, include the neurodevelopmental disorders such as ADHD and autism spectrum disorder, mood disorders, and such as the major depressive disorder, including the bipolar disorder, anxiety disorder, schizophrenia spectrum disorders, personality disorders, eating disorders, and substance related disorders. However, it is important to remember that diagnosis is only one part of understanding the person. No diagnosis can fully capture the complexity of an individual's life, experiences, strengths, and challenges. Symptoms can overlap across multiple disorders, making assessment a thoughtful and ongoing process. Culture, environment, personal history, and individual experiences, they all influence how symptoms are expressed and understood. As future clinicians gather more information over time, diagnosis may be refined or adjusted to better reflect the person's needs. Most importantly, a diagnosis describes what someone is experiencing. It does not define who they are. The goal of diagnosis is not to label people, but to understand their experiences, guide effective treatment, and support healing and recovery. As future psychiatric mental health nurse practitioners, we must always remember to place the person before the diagnosis. Compassion, empathy, cultural humility, and individualized care remain at the center of effective mental health practice. Classification is a tool, not a definition. Every patient is more than the diagnosis. Now that we have explored the causes, symptoms, and diagnosis of mental illness, let's discuss treatment and interventions. One of the most common important messages in mental health care is that hope, healing, and recovery are possible. Mental health treatment is not a one size fits all. Effective treatment should be personalized, collaborative, and compassionate, taking into account each individual's unique needs, goals, culture, strengths, and life experiences. The first major treatment approach is psychotherapy. It's often called talk therapy. Psychotherapy helps individuals better understand their thoughts, emotions, behaviors, and relationships. It provides a safe and supportive environment where people can develop healthier coping strategies and work toward personal growth. Several evidence-based forms of psychotherapy are commonly used. They are cognitive behavioral therapy, or CBT. It helps individuals identify and change unhelpful thought patterns and behaviors. Dialectical behavior therapy, or DBT, focuses on emotional regulation, stress tolerance, mindfulness, and interpersonal effectiveness. Psychodynamic therapy explores unconscious thoughts and past experiences that may influence current behavior. Family therapy involves family members in the treatment process to improve communication, support, and relationships. The second treatment approach involves medication management. Mental health medications can help restore neurochemical balance and reduce symptoms that interfere with daily functioning. Common medication categories include antidepressants, anti-anxiety medications, mood stabilizers, and antipsychotic medications. As future psychiatric mental health nurse practitioners, medication selection should always be based on a comprehensive assessment, evidence-based practice, patient preferences, and ongoing monitoring for effective and side effects. In addition to therapy and medication, lifestyle and self-care practices may play a significant role in supporting mental wellness. Regular sleep, balanced nutrition, physical activity, mindfulness practices, time spent in nature, and creative activities can also collaborate and contribute to improved emotional and psychological health. These healthy habits often complement formal treatment and help build resilience. Another essential component of recovery is social support. Connection is a very powerful protective factor against mental illness. Family members, friends, support groups, community organizations, and faith or spiritual communities can provide encouragement, understanding, and practical assistance during difficult times. Research consistently shows that strong support systems improve the treatment engagement and recovery outcomes. It is also important to recognize when someone may be experiencing a mental health crisis. Crisis support services provide immediate assistance for individuals who are experiencing emotional distress, suicidal thoughts, or other urgent mental health concerns. In the United States, the 988 Suicide and Crisis Lifeline offers free and confidential support 24-hour a day, 7 days a week. Individuals can also text HOME, to 741-741 to connect with a trained crisis counselor. In emergencies involving immediate danger, emergency services should be contacted by calling 911. Above all, every person deserves to know that they matter, their feelings are valid, and help is available. Recovery does not always mean returning to how life was before. Instead, recovery is about building a meaningful, fulfilling life despite challenges and continuing to move forward with hope. As future psychiatric mental health nurse practitioners, our role extends beyond prescribing medications or diagnosing disorders. We help empower individuals, foster resilience, promote recovery, and provide compassionate care that supports the whole person. Remember, you are not alone. Help is available, recovery is possible, and every person deserves the opportunity to heal and thrive. One of the most important topics in mental health care is understanding the impact of stigma, ethics, and cultural considerations. Mental health affects people from every background, culture, age group, and community. Yet many individuals continue to face barriers to care because of stigma, misunderstanding, and discrimination. As future psychiatric mental health nurse practitioners, it is our responsibility to promote dignity, respect, and equitable treatment for all individuals. Stigma refers to negative attitudes, beliefs, and misconceptions about mental illness. These harmful beliefs can lead to discrimination, social isolation, shame, and feelings of rejection. Stigma may also prevent individuals from seeking help when they need it most because they fear being judged or misunderstood. Words matter. The language that we use can either reinforce stigma or promote healing. Person-centered language, such as saying a person living with schizophrenia instead of a schizophrenic, help recognize the individual beyond their diagnosis. By choosing respectful language, we contribute to a more supportive and inclusive healthcare environment. To reduce stigma, we must lead with respect, compassion, empathy, and inclusion. Every person deserves to be treated with dignity, regardless of their diagnosis, background, or life experiences. Mental illness does not define a person's worth, abilities, or potential. Ethics play a critical role in mental health practice. Ethical principles guide healthcare professionals in providing safe, responsible, and patient centered care. One key principle is confidentiality, which protects the patient privacy and personal information. Patients must feel safe sharing sensitive information without the fear that it will be disclosed inappropriately. Another important principle is informed consent. Patients have the right to understand their treatment options and participate in decisions regarding their care. Respecting autonomy means that recognizing the patient's right to make informed choices whenever possible. Beneficence refers to the responsibility to promote well being and act in the patient's best interest. Non maleficence, often summarized as do not harm or do no harm, reminds the healthcare providers to avoid actions that may cause unnecessary harm or suffering. Justice emphasizes fairness and equal treatment. All individuals deserve access to quality mental health care, regardless of race, ethnicity, gender, socioeconomic status, religion, language, or cultural background. Culture also significantly influences mental health. Culture shapes how people understand emotions, describe symptoms, cope with stress, seek support, and view treatment. Beliefs, traditions, values, language, and family dynamics can all influence an individual's mental health experience. Because of these differences, cultural humility is very essential. Cultural humility involves ongoing self reflection, active listening, openness to learning, and respect for each person's unique experiences and perspectives. Rather than assuming we know everything about the culture, we approach each patient with curiosity, respect, and a willingness to learn. Healthcare providers must also avoid stereotypes and assumptions. Individuals within the same culture group may have very different beliefs, values, and experiences. Different does not mean wrong, though. Providing culturally responsive care means recognizing and honoring those differences while delivering evidence based treatment. Despite ongoing progress, several challenges remain, including discrimination, limited access to resources, lack of mental health education, and widespread myths and misconceptions about mental illness. Education and awareness remains the very powerful tools for reducing the stigma and improving access to healthcare to care. The key takeaway from this slide is to treat everyone with kindness, challenge stigma whenever you encounter it, uphold ethical standards, respect the culture and diversity, and advocate for mental health care for all. As future psychiatric mental health nurse practitioners, our goal is not only to treat the symptoms, but also to create an environment where every individual feels respected, valued, heard, and understood. Remember, mental health is a human right. Understanding will bring kindness, and kindness can change lives. As we conclude this content, let's focus on one of the most important messages in mental health care: the recovery and hope. Mental illness can be challenging, but healing is possible, and no one has to face their journey alone. Recovery is not a destination, it is an ongoing process of growth, learning, resilience, and self discovery. While recovery may look different for each individual, it remains achievable for many people living with mental health conditions. Recovery often involves learning to manage the symptoms, developing healthy coping skills, improving quality of life, pursuing meaningful goals, and finding a renewed sense of purpose. Progress does not happen overnight. Small steps taken today can lead to significant positive changes over time. One of the most powerful ideas in recovery is that the future is shaped by the choices we make today. Every positive choice, whether attending therapy, taking prescribed medication, practicing self care, reaching out for support, or just simply getting through a difficult day, contributes to a long term growth and healing. The journey toward recovery is supported by several important factors, and these are the hope, support, resilience, personal growth, and overall well being. Hope helps individuals believe that positive change is possible. Support reminds people they do not have to face challenges alone. Resilience allows individuals to adapt and recover from setbacks. Growth comes from learning new skills and gaining insight. Together, these elements help build a foundation for lifelong wellness. Building a brighter future often begins by focusing on what we could control, setting realistic goals, celebrating progress, learning from experiences, maintaining supportive relationships, and keeping hope alive are all essential parts of recovery. It is very, very important to remember that progress matters more than perfection. Recovery is not about never struggling again, it is about continuing to move forward despite the challenges. Every individual also possesses strengths that can support recovery. Courage helps people face difficult situations. Perseverance encourages them to keep going even when progress feels very slow. Creativity, on the other hand, can help identify new solutions to problems. Kindness, both toward oneself and others, promotes healing and connection. Self awareness allows individuals to better understand their emotions, needs, and personal triggers. Support and resources are always available. Individuals may benefit from talking with trusted friends or family members, seeking help from mental health professionals, joining support groups, or utilizing crisis services when needed. Reaching out for help is a sign of strength and not weakness. As future psychiatric mental health nurse practitioners, one of our most important responsibilities is to help patients recognize their strengths, build resilience, and maintain hope. Our role extends beyond symptom management. We also help individuals discover their capacity for healing, recovery, and personal growth. Before we end, I want to leave you with a few important reminders. You are worthy, you are enough, and you are not alone. Every person's story matters, and every individual deserves compassion and understanding, and most of all, support. The final key takeaway from this content is one step, one day, and one choice at a time. A brighter future is very, very possible. Thank you for joining me as we explore the foundations of mental health, mental illness, treatment, recovery, and hope. As future healthcare professionals, may we continue to advocate for mental health awareness, challenging the stigma, provide compassionate care, and help create a world where every person feels valued, supported, and empowered to heal. Keep going because healing is possible and hope remains.